Good morning. Let us know when you're good to go.
Afternoon.
Good to go? Thanks. Well, the Chief Health Officer of Queensland, Dr Gerard, has advised the Queensland Government that he intends to lift the COVID advice from green to amber from tomorrow. The reason why this is happening is we have seen a significant increase in reported active cases in aged care, ambulance call-outs and, of course, COVID patients in our public and private hospitals over the last week. In fact, we have gone from 105 patients last Thursday to 203 COVID patients across our public and private system as of today. With this increase, we know, and it's been advised to us, that we are now in a fourth wave. These are sub-variants of Omicron that we are dealing with, and what we want to say to everyone is we know how to manage COVID. We have been living with COVID for some time now. We know that following the advice will get us the best outcomes, but the most important things people can be doing is getting up to date with their vaccinations for COVID. So if you have not and you are due for your second, third or fourth booster, then please do get that. The third booster, for those over 30, that would be the booster that people should be getting. If you're 50 and over, you are eligible for a fourth booster, which you can get from your GPs or your pharmacists. So we strongly encourage, as we move into this fourth wave, to go get your vaccination now to ensure that you have the most protection that you possibly can. We are seeing at this stage the bulk of the cases in Metro North Hospital and Health Service and the Gold Coast Hospital and Health Service, but we expect that we will see broad transmission again of these sub-variants. So what AMBER means is it is a recommendation. These are not binding directives. We are giving people advice and recommendations to follow, which is to wear a mask in healthcare settings, indoors if you cannot socially distance, on public transport, wearing a mask if you're older or medically at risk, and if you're around people who are particularly vulnerable to COVID-19. We are asking people that if you are living in a household with someone who has tested positive for COVID, that you test yourself every 2 days to assess whether you have COVID. So 3 key things: get tested if you have symptoms, upload that test result. It's important that we still ask people to register their results so we can get an idea of the number of active cases out there in the community, and of course getting vaccinated. In addition to the public traffic light signals that we have and the system that has been put in place by the Chief Health Officer, of course we still have our 5-tier system within our hospital service. Most of our hospitals are on tier 1 and 2 currently. We are well below the peak that we saw previously, which was 1,123 beds across our public and private health system. So our health system is well prepared. We will move through those tiers if we see a significant escalation of those cases, and the hospitals will deal with that at a hospital and a HHS level, depending on where the relevant cases are. I'll now hand over to the Chief Health Officer.
Thank you very much, Minister. There is now very clear evidence that a new wave of COVID-19 is developing in Queensland. This is our fourth wave for 2022, and it is not unexpected. We expect to see waves of this, intermittent waves of this type, continuing for some months or even longer. That is why we have developed the traffic light system in collaboration with the Commonwealth, so that Queenslanders can have some indication of where we are in the cycle of the pandemic and what actions they can take. Interestingly, most of the increase in activity has been seen over the past week, particularly since the weekend, in fact. The very latest Queensland COVID data that has just come in shows that over the past week, There has been a 58% increase in active cases. There has been an 85% increase in aged care residents with COVID-19. There are 203 people with COVID-19 in Queensland hospital beds, that's public and private, an increase of 93% since last week. And most of this, interestingly, has occurred since the weekend. If there is one thing I can say to the people of Queensland, it's that the single most important thing that you can do now is to get up to date with your vaccinations. That trumps everything else. We still are lagging in terms of our booster rates in Queensland. If you're over 50, get that 4th dose of vaccine. If you're under 50, you should have at least 3 doses of vaccine. That is if you're an adult. If you're an adult under the age of 50, you should have at least 3 doses of vaccine. If you're the age between the ages of 30 and 50, you can consider having a 4th dose. I would myself, but certainly if you're over 50, definitely get that 4th dose of vaccine, because we still have people over the age of 50 in Queensland who have not received that 4th dose of vaccine. And we know it protects you from severe disease. We know that most people who are up to date with their vaccines do not get very sick with this virus, and they do not end up in hospital. The other thing that I wanted to mention was that if you're over 70 or immunocompromised, now is also a good time to make sure you have a plan for accessing antivirals if you're entitled to them. Make an appointment with your GP and just make sure you know how to access those antiviral medications, which we now know are very effective. Other advice, of course, is that if you are sick, stay at home until you are well again. Get a RAT test and register a positive result, please. It's good to see the Queenslanders are doing that, but if you can do that, please, it helps us enormously in terms of tracking the pandemic. Wear a mask for 7 days after your diagnosis of COVID-19 and avoid visiting vulnerable settings like hospitals and aged care facilities. Household members should also monitor for symptoms, because we know that if you're a household member, there's a good chance you will get COVID-19, and test when you do get those symptoms. Now, we advise everyone, this is not a mandate, this is advice. We advise everyone to wear a mask. In healthcare settings, where it actually might be a requirement of that venue. So even though overall we are not making any sort of mandate, these are recommendations, in healthcare settings like hospitals, aged care facilities and GPs, that may be a requirement of that facility. So certainly in public hospitals it will be a requirement while we are at amber. But elsewhere, if you're in a crowded indoor environment where you can't socially distance, consider wearing a mask. If you're on crowded public transport, consider seriously wearing a mask. And if you're older or medically at risk in public, you should wear a mask. Also, if you're around people who are vulnerable to COVID-19, you should wear a mask if you've got COVID-19 yourself. So what are we seeing in the community at the moment? We're seeing a bit of a mixture of viruses, a bit of a soup. There is no clearly dominant strain at present, but we are seeing growth in XBB and BQ1. XBB and BQ1. And BQ1 does seem to be growing particularly quickly in Queensland at the moment. Whether it will emerge as the dominant strain, we're not sure yet. It is the same strain that is growing very rapidly in the United States and has spread widely across Europe. It's the BQ1 strain. But we'll see in the coming weeks whether that starts to dominate. At the moment, it's a bit of a soup of variants. So what will be the trajectory of this wave? Everyone obviously is concerned about Christmas, and that's probably one of the commonest questions we're getting. Will this affect Christmas? Now, what I can say is we are pretty confident that the peak of the wave will occur prior to Christmas. So the peak of that's not the end of the wave, but the peak of the wave will occur prior to Christmas. Now, the shape of this particular wave is difficult to predict. If it takes the same shape as our previous waves, the peaks have occurred at between about 5 and 6 weeks from the onset. So that would put a peak somewhere around the 12th or the 19th of December for this 4th wave. But interestingly, recent experience overseas has suggested that these waves, now that there is a lot of immunity in the community, might be shorter and sharper, and we're hoping that will be the case with this wave. We don't know that, but that is certainly the observation in Singapore and Europe, where the waves were generally about 4 weeks in length, which would put the peak just around the beginning of December. And so hopefully a lot of that will have, the virus will have, this pandemic wave will have cleared by Christmas time. So as I said before, this pattern of intermittent waves is likely to continue for months or possibly even years. That is why we have devised this communication system. If you are up to date with your vaccinations, you are likely to recover from COVID-19 without any problems. But for the next few weeks, if you get sick, please be vigilant and avoid spreading the virus to others who might be more vulnerable. Thank you very much.
About those strains.
Yes.
XBB.
Yes.
I forgot the other one you mentioned. Sorry.
BQ1. BQ1.
Yes. Is there any evidence that they are resistant to previous infections or vaccines?
Yes, I can talk about that. They are more. They're more likely to escape immunity. So that's why they're becoming more dominant. So even though the vaccinations do provide protection, as all our immunity wanes over time, they're more likely to escape and cause infection, and that's why they are becoming dominant. There is also a particular problem with some of the treatments that we give for COVID-19 to people who are immunosuppressed. We use monoclonal antibodies for people who are immunosuppressed, people with transplants and the like, and the treatments are less effective against these strains, which is concerning us somewhat.
And I guess the follow-up to that is if they are more resistant to previous infections,
yes,
antibodies and vaccines,
yes,
is it making people more sick, or is...
No, they're no more sick than previously. So it's the same illness, you're just escaping through, and as time goes by, our immunity does wane, and we are more likely to get an infection, although we know that vaccination and previous infection still protects the vast majority of us from serious disease.
I guess, as you say, I'm trying to get an explanation,
Sure.
I guess, an understanding of how, if these variants are more likely to escape
yes,
immunity, how is it that they don't make us more sick?
Oh, because you still have some immunity. So they escape immunity to the point where they're able to cause an infection, which might be a mild illness, like a flu-y illness. But they don't generate large amounts of virus and cause severe disease if you have some degree of immunity. So, I mean, as everyone is aware, of course, in 2022, COVID-19 looks nothing like COVID-19 in 2020-21 prior to immunisation, when people got desperately unwell, even young people got desperately unwell. We are seeing much less of that now with immunisation. And Queenslanders, we know also at least 2/3 of Queenslanders have had COVID-19 now, and with 93% having had at least 2 doses of vaccine, that means the majority of Queenslanders have hybrid immunity. That is a combination of vaccination plus natural infection, which is particularly predictive against severe disease.
Sorry, do you think anything has sparked this wave, or is it the natural progression of...
It's probably a combination of two things, some degree of waning of immunity and these new variants. And that pattern is likely to occur until even more immunity grows in the community. And we expect, the general expectation is over a period of time, this virus will vanish into the background of other viruses. But that still might take many months. It could even take years. No one knows. No one knows for certain. This could be a long process.
Dr. Gerald, you mentioned it would peak before Christmas. I guess
yes.
With the increased socialisation that comes with this current period,
yes,
do you anticipate, I guess, that is there a chance that hospitalizations will be higher than our previous peak, or do we have any forecasts as to where it might be?
We don't know for certain, and the modelling, I don't think we can rely on the modelling at the moment because there are too many variables. What we can use to guide us is what has happened, say, in Singapore and in Europe, where these most recent waves have been smaller. Interestingly, they had a wave about a month or two ago, which for some reason we have avoided until now. If it follows the pattern that has been seen in the Northern Hemisphere, we are hoping it will be shorter and sharper, but there's no guarantee of that. I really want to emphasise, there's no guarantee of that at all.
What is
In terms of the availability of of vaccines? People want to go to their pharmacy and their GP. Is there enough stock?
There's plenty of vaccines. They're still available in GPs and pharmacies as before. It's very easy to get vaccinated.
What are you noticing about hospitalisations? Like what's standing out? How sick are people?
I don't have enough information. Well, they're the same as before. So no, I've been in the hospitals in the last week. I've been, interestingly, even hospitals in the Darling Downs had been seeing cases. So even though the majority of cases have been here in southeast Queensland, it spreads very quickly across the state. So there were people being admitted to hospitals in the Darling Downs over the weekend with COVID-19. They were the same. It was the same sort of pattern as we've seen previously. Again, mostly elderly people, mostly with underlying medical problems, who are being admitted to hospital. And I don't have any information on their vaccination status.
You mentioned this 58% change in active cases. Do you have the stats of what the cases were and what they are now?
The number, the actual
Yeah,
crude
numbers,
number,
yeah.
I'll have to get that for you.
In terms of the latest vaccine, is that actually, if people have been vaccinated with the very latest vaccine
Yes.
booster, does that give you a better protection against a more severe illness now, as opposed to if you had your booster, say 6 months ago?
It certainly is the case that the recentness of your vaccination or infection confers the maximum immunity. That's why if you haven't had your booster yet, this is a perfect time to get it. Because if you get it right now, you'll have peak immunity just as these numbers climb.
And I guess if there was a latest version of the vaccine, doesn't necessarily provide any extra protection against these latest strains.
The previous boosters are effective. These are all variants of Omicron. Okay, these are all variants, and we know that the previous vaccine protects against the Omicron infection. These new variants, for example, they're actually a variant of the BA5, and we know that the vaccines were effective against Omicron strains.
What's the bar for the red, like from green, amber, and then
They'll be higher. It's significantly higher, where hospitals are coming under significant challenge.
yeah? So of those 5 tiers, I guess. what
Three
tier?
tiers for
Three.
the public alert, the traffic light system.
Yeah.
So that would be the very highest. That would be where hospitals are coming under very significant strain.
And just to reassure people going into Christmas, we know there's been the law changes with show powers, but there's no chance of, say, lockdowns, or what's the kind of most extreme measures we can see?
I cannot see a circumstance under which we'd do anything, have any additional mandates between now and Christmas. There would have to be something absolutely exceptional.
What's the likelihood of getting to red? What's the likelihood of getting to red in this way?
I think, well, no, I can't comment. I think it's unlikely, but no, I don't. Most of the modelling now has become very difficult because of the number of variables involved. So we hope it will be a short and sharp wave, but we don't know that.
Just, I guess the data that is publicly published now is the weekly, if I'm not wrong, on hospitalizations.
Yes.
Will that change? Will we go back to a daily reporting?
We don't plan to. The problem with the daily reporting is that there's so many fluctuations in the daily numbers because of other variables that it actually was somewhat confusing. The rationale, it was a national decision to go weekly, was it would iron out all the bumps that we were seeing with daily reporting.
And with those settings, it's recommended to wear a mask. Does that include, say, prisons or detention centres like we've seen in the past, or aged care, or is it just health settings?
We haven't made specific recommendations for prisons. Thank you.
Thank you. We'll get those.
Yeah.
Sorry, another question. The variants,
Yeah.
I believe so. I believe they're still publishing.